All right. Good morning, everybody. My name is Jason Flame, board member for the Moorpark Chamber of Commerce, and we are back for another chamber chat today with an amazing guest, one of our longstanding board members and huge supporters of the Moorpark Chamber of Commerce. This is Michelle Barrett. She is a respected healthcare leader with over 30 years of experience in medical imaging, leadership consulting, and education. A proud Moorpark resident for the past 23 years, Michelle has built a reputation for transforming teams, elevating patient care, and earning national recognition with an American Business Stevie Award. As imaging services manager for Los Robles Health Systems, she leads with excellence while creating a positive, patient-centered culture. Beyond her career, Michelle is deeply committed to Moorpark through her service on multiple boards, supporting business, education, youth, and community growth. Well, Michelle, we finally got you scheduled. You're on the show.
I don't know. I was apprehensive. It's like, what am I going to talk about for all that time? And
Well, go ahead.
I still have a little jitters about public speaking, but I'm getting better.
You know what? I think we all do. And I've done, this will be number 97 for Moorpark Chamber of Commerce, but I've hosted over 500 podcasts, and I still get a little bit of the jitters every time. Mostly because I'm excited to share whoever my guest is on the show and to share their story and to talk about them, because you've got a lot to talk about, a lot more than you think about. And you're very humble in that you're not sure what you're going to talk about, but I'm going to ask you the right questions to make sure we talk about all the right things. So tell me a little bit about yourself, or tell the audience a little bit more about yourself, your involvement in Moorpark, how you came to Moorpark. Just give us some of your background.
So, first of all, again, my name is Michelle Barrett, and I am currently the manager of Los Robles Imaging Center. I do have an extensive background in medical imaging. My whole career has been in medical imaging. I've been a resident of California for quite a few years, more than I'd like to say, but I have been a resident of Moorpark for 23 years. And Los Robles opened the imaging center. Actually, they hired me to help open the imaging center 15 years ago. So we're going to be celebrating our 15th anniversary this year. I trained in Michigan, had very good training. And when I came to California, first of all, I was a stay-at-home mom for a little while. And then I went to work at Tarzana Hospital in the Valley. Mm-hmm. Quickly found out that my training was a little different than the way things ran here. And so I was a technologist there. And mind you now, in Michigan, I worked for a private practice for a while. I worked with a radiologist who had 2 offices. And Monday through Thursday, he was in another office. Fridays, he would come to the office that I was in. And Monday through Thursday, I did everything that he should have been doing. He taught me things that I shouldn't have been doing. According to our licensure now, we'd be in trouble. But I did GI studies. I did nuclear medicine studies. I did mammography. And with mammography, he taught me how to do clinical exams. He taught me, of course, I knew how to do the actual mammogram already, but I had to do clinical exams. If there was an abnormality, I had to explain it to him. I had to do a diagram of where it was located. I learned a lot. I was like a mini radiologist, actually. And I enjoyed that. So when I moved out here and I went into the hospital environment and was a technologist, and all I did was take x-rays, which is important, of course, and do radiology exams in a radiology department, it was kind of boring to me, actually. I wanted to do more. So what I would do in our downtime is that I would kind of follow my boss around, the director, and say, can I help you do something? Not that I was trying to do her job, but I just needed other things to do. I wasn't into going in the break room and gossiping with everybody. That just wasn't me. So as a result of that, our assistant, not as a result, but when our assistant director went on a medical leave, she assigned me his duties. And shortly after that, she was terminated. And so here I was, the assistant director, and now I'm the interim director. And I was like, oh boy, this is a lot. I didn't know what I was doing really, but I'm always up for a challenge. So I immediately got back in school, started taking all kind of management courses and training, and I faked it until I made it. I was the imaging director, but I learned everything I needed to know. They hired a director, and when he came on, he said, I'm not going to be here long. My wife has a job coming up out of state. So before I leave, you'll be able to step into this position. And that's exactly what happened. So that's how I took the next step into leadership. But I'm sure I'm missing something about my training and everything.
Well,
But
we'll get to that. We'll come back to the questions here in a second.
yeah,
So you grew up in Michigan, though, and what made you move to Moorpark? Was it a
actually,
job?
no, it wasn't. Actually, my ex-husband was in entertainment,
Mm.
and so he decided that this is where he needed to be. And it was true. This is where he needed to be. And it was a hard transition for me because I left all my family. My daughter was like 2 years old, and my mother was crushed because I took her baby, not my baby, I took her baby. And it was hard. It was hard for quite a while. It was really hard. And, you know, that's how I ended up here and how I ended up staying here.
So now, did you move directly from Michigan to Moorpark, or just kind of in the surrounding area?
No. I lived in Woodland Hills initially,
Got it. Okay.
and I ended up in Huntington Beach because I took the position as director in Tarzana, and they did a restructuring, and all of the mid level management, they kind of did management clusters. So they assigned all these departments to the vice presidents. And so, luckily for me, though, while I was working at Tarzana, there was a physicist that I became good friends with. And he taught me a lot. Just again, me being inquisitive and not wanting to sit around gossiping, I would talk to him. And so he taught me a lot about what he did and regulations that were coming down from the FDA. It was right before the FDA started regulating mammography. So he would go out and do testing on this equipment, and if someone failed his inspection, he would tell them, I know someone who can help you. And I had studied those regulations and I knew them like the back of my hand. So I would go in and help people get in compliance so that when they had their next inspection, they would pass. Because they give you like 30 days to get your act together. And then
Mm-hmm.
come back. If you failed again, then you were in trouble. So I did that for a while. But the problem with that is that physicians weren't very good at paying their bills. So I'd be like, oh, I need to pay my rent. I need to do this. I need to do that. And I call Dr. So and so's office, and he's in Europe somewhere. And I'm like, oh no, this is not working. So I started looking for a job, and I went to an interview in Orange County. And driving down there, I'm like, oh no, I can't do this. This is too far. I'm not going to be driving down here all the time. So I interviewed. On the way home, I got a call. We'd like you to come back for another interview, and we want you to take this. It was a personality test. I forget what it's called. Is it called Myers Briggs or something like that? Excuse me. But anyway, that caught my interest. I'm like, oh, good. I'd like to do that. And I'd like to learn more about myself. So I took the test and got a job offer after that. And so I was like, nah, I don't want to move to Orange County. So I kind of like, said thank you, but no thank you. And then I got another call with an offer and a salary. And I said, oh, thank you, but that's a lateral move for me. And that's kind of far. I don't really want to make that move. So in the meantime, one of the radiologists that I used to work with, he had moved up to Mount Shasta and had a practice up there. And he asked me to come and cover for his tech. because she was going on vacation. He had nobody. Pay all my expenses. I went to Mount Shasta. I get a call while I'm there. Okay, look, we'll pay your moving expenses. We'll give you this salary. They sweeten the offer. And the third time, I'm like, maybe this is what I'm supposed to do.
Right.
So I took that job. And I worked with a lady who, to me, she was just the ultimate professional, super sharp, super sassy, very well. And so I just copied her. I dressed like her. I do all of that. And she moved out of state. She got a job out of state. And I'm like, are you taking me with you? Because, I was just used to being with her and I was learning so much from her. And so she couldn't. So I stayed there as a corporate employee for a while. And then that company was sold. So I was unemployed again. So I went to teach at Charles Drew University. I taught mammography there. And I got students prepared to take their exams, their licensure exams. Did that a little while. In the meantime, I get a call from my former boss who had moved away to Texas, and she was back. And she was back in Orange County. And so she said, I want you to interview for this job. And she told me a little bit about it. Now, mind you, while I was at Charles Street University, I was looking all the time. And I would see this job in Oxnard. It was a new facility. And every few months or so, this job would come back on the market. And I'm like, ooh, they got problems there. They can't keep a manager. And so when she called and told me it was in Oxnard, I was like, ooh, I hope it's not that facility where they're got this turnover, So I went and interviewed with her. She was a vice president and the COO. And they offered me the job. And so I took the job and I thought, ugh, I don't want to live in Oxnard. So I said, but I don't really want to move. They said, no problem. They put me up in a hotel Monday through Friday, and then I would drive home on the weekends. So they did that for a while until they got tired of paying for it. And they said, you got to move. Oh, Lord, I didn't like Oxnard because of the overcast and everything. I was a mile away from the beach where I was, and so I didn't want to go. But anyway, again, we'll pay your expenses. You don't have to worry about any of that, but we need you to move. So I moved, went there, worked there for, I want to say 7 years or so. They sold the company. And so the office or the company that I worked for was a partnership with St. John's Hospital. And St. John's Hospital, a lot of politics and everything, but they wanted me to stay. And they partnered with another radiology group. They had all their leadership people in place, and they could not get them to talk to me. So I'm like, ooh, I'm going to be out of the job. So in the meantime, she says to me, they're opening an imaging center in Moorpark. And I'm like, well, I live in Moorpark. That would be perfect. So I came over here. I looked at the facility, looked at the building because it was a shell on the inside. And I looked at it and I said, I'm going to get that job. And I thought about it. And I went on an interview and got hired right away.
Nice.
That's how I ended up here. But digressing a little bit, the way I got into leadership was in high school. I was in a program where it was a co-op program, and we got jobs after school. I had a job at the IRS as a student. And so the director of the department that I worked for was this very impressive, excuse me, I have allergies this time of year.
Oh, I get it. I understand.
Working right now. But anyway, she was just so impressive. And I would always look at her like, I want to be like her when I grow up. And so, again, another person that was always in the back of my mind, in addition to the boss that I had in Orange County. These were both very dynamic women. And so I just learned a lot from them and learned as much as I could. And there you go. That's how I ended up in management or leadership.
That's amazing. That's a great background. And as you can see, or maybe you didn't see it, but Jackie is watching, and she said she just loves hearing about your background and your story, and you're so
Oh,
inspiring.
oh, that's
You know, you have built an incredible 30-year career in medical imaging, rising from radiologic technologist to leadership. What lessons from the front lines helped shape the leader you are today?
number one was the first lady that I worked for at the IRS or worked with, emulating her. And then when I was training, I learned who I did not want to be like,
Mm,
you know.
yep.
And so one of my first patients that I had when I graduated was a woman who was close to my age. She was in her 30s, and she had just delivered her first child, and she had cancer. They found out when she went into the hospital to deliver her baby that she had cancer. And I will never forget her. From the first time I did an x ray on her, we kind of connected. And she was in the hospital a long time because, of course, by the time they discovered it, it was pretty far along. And whenever she would come down for an x ray, which was quite often, she wouldn't let anybody touch her but me. And so we bonded. We were very close. And she, of course, didn't make it, but I learned about compassion. I learned about how important it was, how you made people feel, because I think that she felt safe with me. She felt that I was going to take care of her, and that I think she felt my heart for her as well. So that was kind of the beginning of me really, really thinking about what I did and the impact that it had on people.
Hmm.
So I kind of carried that with me, and I've passed it on to people that I've worked with.
Yeah.
The team that I have right now, we've been together like 20 years or more. I brought them with me from my previous job
Mm,
because these are people I brought the best, of course, but they're people that I had confidence in, and I trained them, and we work really well together, and it translates to our patients because a lot of times patients will come here and say, "You guys, I just really love coming here. You guys are so great. You guys just get along so well." Sometimes people
yeah.
can't believe that we don't have drama. People in the office that we're close with, and they'll tell us about what's going on in their office, and they're like, "Do you guys have drama like that?" And we're like, "No, we don't operate like that." And they can't believe it, because they think a group of women here together, I know you guys have some kind of drama. And no, we don't. No, we don't. We have a common goal, and that is taking care of our patients, making them feel comfortable when they're here, making them feel cared for, and, you know, taking care of them and not having them sitting here for hours.
Right. Well, your lesson of leadership reminds me of the quote, people don't care how much you know until they know how much you care. And so that I think is something that you exude. And I know that when Jackie goes to see you, she feels so comfortable and she feels so good, and you guys have a great relationship. And I think that people that really get to know you know how much passion you have in what you do, but also how much you care about people and take care of people. You
Yeah.
were recognized with the Stevie Award for turning around a struggling imaging center. What were the biggest changes you made, and what can any business leader learn from that experience? First, tell us what is the Stevie Award, and then answer that question. What were the biggest changes you made?
Well, it's an American Business Award, and the president of the company that I worked for in Orange County nominated me for that award for the place that I didn't want to go in Oxnard. They had been open for 2 years and they weren't doing well. And so when I went to interview for that job with my former boss, I got the job, never met my boss, the person I was going to report to. But when I showed up, it was like right after the new year because I said, "Can I get through the holidays and then I'll start?" So they had an interim manager, and we would talk on the phone occasionally because it was about a month before I actually took the job. And he sent me the budget, and I was looking at it, and I'm like, either I'm committing suicide or I can be a hero. Because all I saw was red. And I'm like, now I see what was going on inside and
Hmm.
why I'm seeing these ads all the time for this job. So I had learned a lot, like I said, at my former job with my former boss. And so I saw all the problem areas. So I show up my first day on the job and I walk up to the reception desk, and there are two ladies sitting there, and they are doing their job, and their heads are down. And I stood there quietly just to see how that would go. And finally, I had to say, "Excuse me, hi." They're like, "Oh, hi. How can we help you?" I'm here to see Mike. I forget what his name was at the time, but that was my boss who was waiting to meet me for the first time. And so I said, "Well, I'm here to see Mike." And they're like, "Oh, and your name is, who are you?" "I'm Michelle. My name was Underwood at the time. And I'm your new manager." And of course, their eyes got big. They realized, oh, she was staying here a little while or whatever. But they learned real quickly that that was the wrong thing to do. Not that I went in there with a heavy hand or anything like that. I knew what I needed to do because I had seen the budget. So I knew the areas that were a problem. And
Hmm.
so I just went about fixing them. I one of the first things I did was I met with the staff. I had about 30 direct reports at the time. I met with each one of them just to get to know them, give them an opportunity to hear from me and, find out what I'm about. And so I did that and I learned a lot from that because there were people that, were really into what they did. They were, solid employees. And then there were other people who threw each other under the bus and they talked all kind of smack about each other. And I just listened, you know, and I kept mental notes of who was staying and who was going pretty much because it was bad. It was a mess there. It was a real mess. And it was a learning experience for me because I had never worked in such a difficult environment because they were used to doing their own thing. They managed their schedules. If they did not want to work or they had something else going on, they closed the schedule. Okay, we're not doing ultrasound today because so and so's not coming in. Or we're not doing CAT scans, or we can only do this many because we have one tech. That was ludicrous to me. So, of course, I put a stop to that. I took over the schedule. They didn't like that. They didn't like that at all. There were people who had cell phones, work cell phones, who never left the facility. And we are a 9 to 5 facility. Nobody's getting called in the middle of the night. Nobody's taking any long leads or leaving for any long periods during the day. So I quickly got rid of those cell phones. They had a cookie budget. The marketing person was supposed to be taking out these fresh baked cookies to the doctor's offices. The staff was baking cookies whenever they felt like it and eating up cookies, and they weren't good for the doctor's offices. They had a flower budget where physicians' offices got fresh flowers once a month. The flower budget went away. So I cleaned up the budget, and in the process, I had to clean up some people. The first thing I did was I bought, I don't know how many copies of the book Who Moved My Cheese. I don't know if you've ever heard of that book,
Hmm.
but I gave everybody a copy of Who Moved My Cheese. Those who got it, got it. Those who didn't, I learned this phrase, groom them or broom them. That sounds cool, doesn't it? That's kind of how it went.
But it's got to happen.
It's got to happen because there were some toxic people there. I had a
Right.
supervisor there who cheated on her time card every pay period. Now, mind you, in my first interviews, somebody told on her and showed me her time cards. They had copied them and showed me all her time cards. And I was like, oh, wow. So the first opportunity was to talk to her. And I talked to her and she did it again. So I had to let her go. The office supervisor was a micromanager. She kept her thumb on everybody all the time. I didn't like that because I don't operate like that. I feel like if you have to micromanage a person, maybe you don't have the right person in that job. So I had to keep her on for a while until I got really comfortable with the operations and everything at that facility. So when I let her go, it was a chore because you have to go through the processes. So I started requiring things of her that made her uncomfortable. And one day she said to me, you know, I'm tired of you and you want this and you and your wants. And so that told me right there, okay. I said, this is not about me. It's about our facility. It's about our job. But every time I turn around, you want this and you want that. And I said, okay. In my mind, it said, and I want you gone right now too. So anyway, I had to
Just like that. She
I
got the
had
broom.
yeah, I had to replace her with the person that I have here in this office right now. So you know, a lot had to be done. A lot had to happen as a result of me doing my job and turning around that facility. One thing, the morale was bad, very bad, because they were supposed to get bonuses and they had never seen a bonus. 6 months after I was there, they got their first bonus. I was so excited. I'm like, oh, look, I'm giving everybody bonus. And I did that and I distributed or divided it the way that I felt it should be divided. The hard workers, people who had good attendance, who had good attitudes, who I didn't have to ever talk to or anything, got more than the people who called out sick at least once a month next to a weekend, or the people who had patient complaints or anything like that. Anything I did, I was fair. I was so fair with that. I was so proud of myself. I get a call from corporate HR saying, we're getting all these complaints about you and the budget. I mean, the bonuses and everything. People are really unhappy. And I was like, what? They never got a bonus before. I was so proud of myself the way I divided the bonus up and so proud of the fact that they got a bonus. And it really hurt my feelings.
Yeah.
So I had to have a staff meeting and I explained to them. I said, would you like the person who calls in sick and leaves you hanging to have the same bonus that you do? Or the person who sits while you run back and forth? I had to break it down like that.
Right.
And I said, one thing that you have to know is that you don't talk about what you get, what your bonus is. You don't do that. I said, so we don't have these problems. Everybody got it except for my MRI team. They still wanted to compare checks and everything. I said, okay, here's what I'm going to do for you. Everybody's going to get the same thing in MRI, no matter what you do. Everybody's going to get the same amount on the budget, the bonus. And that's what I did. And they didn't like that. They knew their partner over here doesn't work as hard as I do.
Right.
So anyway, I established a reputation of being consistent, of being fair, of being being real. Because I'm not the kind of person who wants to be the boss. I'm the boss and you're the subordinate and you listen to me and I'm going to watch you and I'm going to tell you when you can take off and leave. I pretty much let people have work-life balance and I develop relationships with them because I genuinely care about them. And they a lot of them hated me at first, but they learned. I was just patient. I said, once they learn who I am, where my heart is, that should change. And it did for the most part.
Well, Michelle, we have about 5 minutes left, and I want to give you a couple minutes.
I talked this long.
Yeah, no, you're fine. You're doing great. Let's talk a little bit about Los Robles Imaging Center, because we want to make sure that we let our members in the Moorpark Chamber of Commerce know what it is you do, what it is that Los Robles Imaging Center has to offer. So let's talk about that real quick, and then I'll have just one more question for you.
So again, we're an outpatient imaging center. We do x-ray, we do ultrasound, we do CAT scans, we do mammography, and we do bone density studies. So we are actually a department of Los Robles Hospital. So we pretty much operate under that umbrella, just that we're outpatient. The one thing that our philosophy here is that we want everyone who comes here to feel cared for, to feel comfortable, and to know that we're going to do our best for them. That's our goal. And that's how I think, and that's how I kind of train people who work with me to think. That's our priority, patient care. We have to work within the constraints of our parent, the hospital,
Hmm.
but the difference is, this is real important too, is in the hospital, they have, techs have a different mindset. They do a patient exam, the patient goes back to their room. They do that all day, all day.
Hmm.
Here, people have a choice. They have a captive audience over there at the hospital. If a person, you rub someone the wrong way, you know, so be it. They're going back to their room. They'll have a different person the next time they come down. But here, our patients have a choice. Imaging centers basically are imaging centers for the most part, but we have, updated equipment and everything. So we have to distinguish ourselves by our service and how we care for people and the relationships we build. We have patients who were the first people who walked through our doors who still come here. That makes me feel good. That makes our staff feel good because we know we're doing something right. Because they could go to, over there, the Oaks. Anyway, they could go somewhere else, and but they choose to come here. When we get a patient who transfers from another facility, they may come here for one exam, and they're like, "Oh yeah, I'm not going back over there." So we build relationships with our physicians, the referring physicians, their offices, their staff. So we're about building relationships and caring for people.
Well, and speaking of relationships, as I mentioned in the opening, you're a long supporter of the Moorpark Chamber of Commerce. You've been a board member for probably the only board member that's been around longer than me at this point. And why Moorpark? And I know you live here, but why the Moorpark Chamber of Commerce? Los Robles is a huge supporter of our chamber. Why Moorpark Chamber of Commerce?
Well, to be honest with you, the president of the hospital asked me to be on the board for the chamber.
Hmm.
Now, mind you, I was on the board already for the Boys and Girls Club. She used to be a board member for the Boys and Girls Club, and she was too busy to, stay on the board. So she asked me to take her position there. And so that's how I got started. Because if you had asked me, hey, you want to be a board member? Just out of the clear blue, I'm like, I've never done that before, and I don't think so.
Hmm.
I was very intimidated by it at first. But again, my nature is to not turn down a challenge. I just kind of, once I'm in there, I'm going to learn what I need to do. I may be real quiet for a while, but that's why, while I'm processing and learning everything, I remember when I was on the board for first got on the board, maybe a year into it, one of the board members or the chair said, Michelle's very quiet, but trust me, she's not quiet. And so I said, oh, yes, I am. I'm quiet. I'm staying right here. I'm going to do my part, and that's it. So now I probably talk too much sometimes.
Well, anybody that knows you and has worked with you, because I definitely sometimes feel that way, but I know you and know that just like you explained in your story about working in the office that you were working on, you listened to people, you listened to what's going on, and you just wait for that right moment. Because you telling me that you were intimidated being on the board, I'm like, Michelle is like Michelle is the board. Like, I mean, you've always been there, and you always have kind of a plan. You always have something, but you listen and you find the right moment. Whereas sometimes we have people that don't listen, and you brought this up with the company you worked before, and we've seen it on the board where people talk a lot, but there's not really a whole lot of action. And
Right.
so you're, in my opinion, you're a person of action. You might listen and be quiet for a little bit, but when it's time to go, I mean, anytime we ever have an event, everybody knows that Michelle's the go-to person to get things to happen and make things work.
Well, I appreciate that, Jason. But one thing I do want to say is I truly love this community. I've lived here longer than anywhere in my life.
Mm.
So even though I'm from Michigan, from Detroit, my family's there, my home is ever. This is home. This is my home. And I love the community. I love being able to be involved and to give back. I feel like it's the least I can do for the quality of life that I have here. I think I used to say this, I've said this before, and I quote Muhammad Ali quite often, but service is the rent you pay for your room here on earth. So service in Moorpark is the rent I pay for my place in this community.
I think that's amazing. And you are a shining example of service because everywhere we turn around, whether it's the Boys and Girls Club, it's here at the Moorpark Chamber of Commerce, or just in the community, Moorpark Country Days, we can find you being a judge at the event or helping out at the State of Moorpark or any other event. You're always there to lend a hand. So you are definitely a shining example of service. So thank you for your time. Thank you for sharing your story. I hope that everybody who is watching this now live or will watch this later on the replay learns a little bit more about the person, Michelle Barrett, and learned a little bit more about Los Robles Imaging Center. But you can continue to learn more about it as you attend our networking breakfast, our networking mixer, because you'll almost always see Michelle there. So, Michelle, where can people find you or how can people contact you?
Well, Los Robles Imaging Center in Moorpark. We're in the Los Robles Medical Plaza right behind Target. And I'll give you my phone number. It's 805-523-8062. And anyone who has questions, who needs help with getting an appointment, who has issues, questions regarding their insurance, and whether we're in network, out of network, I help however I can. However I can. That's my job. That's
All right. Well, thank you so much, Michelle. And thank you, everybody who is watching today. Don't miss all of our upcoming events. Please go to YouTube, subscribe to our channel for Moorpark Chamber of Commerce. You can follow us on Facebook, Instagram. We're also on LinkedIn, where this is streaming live for the very first time with Michelle. And we hope to see you on the next one. I'll have another amazing guest coming up in the next couple weeks. But thank you again, Michelle.
All right. Thank you, Jason.
All right, guys, go out, have a great day, and we'll see you soon. Take care. Bye-bye.
Bye-bye.